Nestled deep in the heart of Southeast Asia lies the Kingdom of Cambodia. The land of the Khmer people is one of smiling faces and warm welcomes, inviting visitors to immerse themselves in an ancient culture full of many wonders, including the famous Angkor Wat, Bayon, and a myriad of other temples and religious sites with a long and storied history. Bordered by Thailand, Laos, and Vietnam, Cambodia has a population of over 14 million people, many of which live in rural areas of the country. However, Cambodia has also seen its share of hardships, most infamously under the Khmer Rouge rule of the mid-1970s. War, drought, and corrupt governments have lowered the standard of living for many Cambodians. This has left a lasting legacy of suffering and strife for a people who today still feel the effects of a turbulent past. Many rural people live on little or no income and face an uncertain future in the face of poverty, threat of landmines, and disease. Pressures from outside and inside the country's borders continue to make life difficult for many who have limited access to basic necessities like water, food, and medicine. One of the greatest health issues affecting these people is preventable blindness. Diseases like glaucoma and cataracts are among the most common eye health problems faced by poor people. Cataracts in particular account for the highest percentage of eye disease among rural Cambodians. But there is hope. A team of eye care specialists under the NGO International Resources for the Improvement of Sight, IRIS, is making a difference for those affected by eye disease in Cambodia. Director of Field Operations for IRIS, Roger Biggs, leads this team in fulfilling its mandate.
International Resources for the Improvement of Sight, or IRIS as it's known, was founded as a charity in 1996 by Michelle Claudel and John Stewart in response to eye care needs amongst very poor people in Cambodia. The association has two British ophthalmologists as trustees, Andy Richards and John Sanford-Smith, who advise on all medical matters and who themselves have made a significant contribution to eye care in developing countries. Since 1996, IRIS has expanded its program and now supports eye care development programs in Cambodia, Nepal and Sri Lanka. And we have also funded eye care initiatives in Laos, India, and in refugee camps on the Thai-Burma border. IRIS first established an office in Cambodia 15 years ago. At the time, very little was happening in eye care, and there were no eye clinics outside the capital of Phnom Penh. IRIS constructed Cambodia's first purpose-built eye clinic in the province of Kampong Cham, and we have since built a second clinic in the province, the Fix Antonius Iris Eye Clinic at Tabong Kamom. IRIS also started a program of outreach eye camps in remote areas of the country, employing a Nepalese ophthalmologist, Dr. Balkumar Khatri, or KC as he's known, and a team of 20 Cambodian nurses, drivers and support staff. With all the medical equipment they needed packed into two IRIS vehicles, they would set off and travel for up to 2 days to reach remote locations where they would provide eye screening to local communities and identify people in need of blindness prevention surgery. The team would set up an operating theatre, usually in a school or a village hall, and the team would perform between 150 and 200 cataract surgeries before returning to Phnom Penh a week later. Dr. Casey would go back a week later to ensure that none of the operated eyes were infected and that they were all healing appropriately. Today, IRIS is still running outreach eye camps, but now only in 5 of Cambodia's 24 provinces, as over the intervening years the government has established permanent eye care facilities in 19 provinces. The current program of IRIS has 3 components: eye clinics, eye camps and other projects. We currently subsidize work at 4 government eye clinics in the provinces of Kampong Cham, Kampot, Pasat and Battambang. We provide these clinics with all the ophthalmic equipment needed: microscopes, slit lamps, instruments, We also provide all the medical supplies needed for cataract and other surgery. We provide clinic staff with salary incentive payments, and we fund any refurbishments needed to the clinic. Through a partnership with the International Centre for Eye Care Education Australia and the Albatross Foundation of Geneva, IRIS, over the last 2 years, set about establishing refraction services at all the eye clinics we support. This has enabled clinic staff to be able to make and dispense glasses, either for free or minimal cost. To try and identify more patients, we fund eye clinic staff to go out into the community to examine patients and refer them to the eye clinic for treatment. We also fund the training of eye doctors, of nurses, and we provide primary eye care education to village health volunteers and to health centre staff. A typical government eye clinic has 3 to 4 staff. An eye doctor who has undergone 2 years of training so that he's capable of doing the basic blindness prevention surgeries such as cataract and pterygium, and 2 to 3 nurses. And their daily routine is to first examine patients who come to the clinic very early in the morning, check their visual acuity, and then after the morning session they schedule surgery cases in the afternoon. Each clinic performs approximately 500 surgeries a year, the majority of which are to remove cataracts, which is the most common cause of unnecessary blindness in Cambodia. The second component of the IRIS program in Cambodia is the ICAM program. We continue to finance Cambodia's annual program of outreach eye camps in those provinces which remain without any permanent eye care facilities. The 5 provinces that remain without any eye care facilities are visited 8 times a year by a medical team that comprises an eye doctor and up to 3 nurses. They travel up to the province and they spend 3 days in 3 different locations doing eye examinations, and then up to 5 days performing eye surgery in the provincial referral hospital. The final component of our program is the work we do in and around Phnom Penh. This is mainly responding to requests from local voluntary organisations to screen and examine the eyes of the people they're working with, who might be women, orphans, generally destitute people. We undertake examinations of their eyes and we provide them with glasses. For some years now, we have also operated an annual program that examines the eyes of poor cyclo drivers. A cyclo driver is a type of rickshaw driver who transports people or goods around the city. And cyclo drivers are amongst the poorest of the poor living in Phnom Penh, and IRIS provides them once a year with examinations, glasses and free cataract or other blindness prevention surgery at the municipal hospital. IRIS is also supporting the Battambang Ophthalmic Care Centre, which is an independent charity, a local NGO, which has set up an eye clinic, and IRIS funds their annual program of glaucoma surgeries. Since IRIS started 15 years ago, we have provided approximately 145,000 eye examinations. We've restored the sight of 30,000 people, 17,800 of which were removing cataracts. IRIS employs 11 staff in Cambodia, 5 of which are based in Phnom Penh but have travel out to the provinces on a regular basis. And then, as well as ancillary staff, we employ provincial coordinators in the provinces where we support eye clinics, whose role it is to go out and try and find patients and refer them to the eye clinic for treatment. As a charity, IRIS depends on trusts, foundations and generous individuals for support. The annual program in Cambodia costs about $250,000 a year to run, and as a charity, obviously, IRIS depends on trusts, foundations and generous individuals for financial support.